what do I do if I inject too much? So obviously, for those who maybe don't know, the weight loss injection, so we've got the two that we prescribe in weight loss: Wegovy, containing the drug semaglutide, and Mounjaro, containing the drug tirzepatide. Both of them come in a pre-filled injection pen, so you're not drawing up medication, into a syringe or a needle. It comes in a pre-filled pen, and depending on your dose and depending whether you're on a Wegovy pen or a Mounjaro pen, in essence, in a simplistic way, you affix a fresh needle to the pen each time and you turn the pen to select the dose you inject. So usually, for the vast majority of the time, it's quite a fail-safe way to make sure you're selecting and injecting the right dose. But absolutely, this is a different type of a way to take medication. Sometimes people aren't used to it, and maybe you might have injected a bit too much. Now, obviously, depending on which pen, depends on how that could look. But usually you sort of turn it around to the point where you inject the dose you need, and it sort of stops at the limit. So to inject too much, you would have to almost inject the right amount and then go again. But if you have injected too much, then it really depends. If you're brand new to the medication and you inject a bit too much, you might find you get some more side effects than if you have been on the medication for a while and had a little bit too much dose. So the key thing is, if you inject too much, is not to panic. First of all, generally, if you have a reaction to the medication, or if you've injected too much, your issues are going to come based in your stomach. So a big part of how this medication works is to it works in two ways. Number one, it works in the appetite control center of your brain to reduce how hungry you feel. But secondly, these injections have an effect on the gut, and they slow down how quickly food moves through the gut. So it can have side effects on the gut. It can make you feel nauseous. It can make you sometimes feel a bit bloated, sometimes make your stools a bit loose or a bit blocked up. Again, these are all side effects that are quite transient if you get them at all when you take them, and usually very manageable. If you inject a bit too much too soon, you might find that these side effects manifest. Now, the key thing to do is, as I say, not to panic. See how your body responds. The main issue is, if you have taken slightly too much and your stomach and your gut doesn't like it, you might end up feeling nauseous or maybe vomiting, or you might end up having very loose stools. And the key thing that we just want to avoid is dehydration. So if you are finding that it's led you to vomit, or it's making your stools very loose, and the key thing is to make sure that you maintain hydration. Obviously, if you're a patient of ours, then absolutely reach out. Our doctors would be happy to have a chat with you and talk about anything you might be experiencing. But if you're finding yourself particularly unable to keep fluids down, then as per having any sort of gastric issue where you're unable to keep fluids down, you might have to seek some medical support. But generally, this should be absolutely fine, and you should be able to self-manage at home. But if you do need to seek medical help, then again, it's really useful just to take along the pen, so that the healthcare professional that sees you knows exactly what you've injected and can understand. But as I say, it's quite rare to inject too much. The key thing here, and again, this could come up, is sometimes, and we've seen this over the years that we've been prescribing both injections and tablet medication, is the idea that if you take a bit more, you'll lose more weight. And so that's not the case. Remember, these medications, tablets and injections, work by reducing your appetite. They don't make the fat melt off you, and as I've said before, that would be great if they did. They work by reducing your appetite. So by taking more, it doesn't necessarily mean you're going to lose more weight. If your appetite's reduced, then so there should be no reason why you should want to take more. It's really important, especially with the injections, that you go as per the dosing regime, that you do at minimum 4 weeks at each dose before you consider going up. Even if you aren't having any side effects of taking the medication, even if you felt absolutely fine and not had any sort of any sort of side effects or unwanted effects, make sure you still do 4 weeks at each dose. It just gives your gut the chance to be used to the medication, so you avoid experiencing any side effects. And as I've said before, there's no race to the top. You can stay on the dose you're at, and there's also you will start losing weight from starting at day one of the lower dose. You don't need to rush to get to the top dose to start losing weight. Progress happens along the way. Everybody is different. We have treated hundreds of thousands of patients on weight loss journeys, and everybody's dosing regime, speed of changing dose it is individual. So again, there's absolutely no rush. So don't panic. See how you go. Keep yourself hydrated, and reach out to medical support if you need it. I think would be my sort of main points about that.